What happens with your body if you stop sugar for 30 days? Excess weight dragging you down, relentless fatigue every morning, and the constant battle with aching joints. Does this sound familiar? Perhaps you've stared in the mirror, frustrated by stubborn belly fat that refuses to budge, no matter how little you eat. Maybe your doctor has warned you about prediabetes, high blood pressure, or fatty liver. You worry about the future, heart disease, insulin shots, or even amputations like you've seen happen to others. The real culprit? Sugar. It's not just making you gain weight, it's quietly destroying your health. But what happens with your body if you stop sugar for 30 days? Your weight, your energy, even your life? Hello Health Facts family. In today's video, we will learn together about the wonderful benefits our body receives when we stop eating sugar for 30 days. Okay, let's dive in. Number 1, healthier teeth. When you eliminate sugar from your diet for 30 days, one of the most immediate and noticeable benefits is improved oral health, particularly healthier teeth. Sugar serves as the primary fuel source for harmful bacteria in your mouth. When you consume sugary foods and beverages, these bacteria feed on the sugars and produce acids that erode your tooth enamel, leading to cavities, plaque buildup, and gum disease. Plaque is a sticky biofilm that forms on teeth and gums, creating an environment where bacteria thrive and further attack dental tissues. Processed starches, such as white bread, pasta, and rice, also break down into glucose in the mouth, feeding the bacteria similarly. Amylase, an enzyme in saliva, begins this process during chewing. When sugar is removed from the diet, this bacterial food supply is drastically reduced, minimizing plaque and acid production. Furthermore, fructose, a component of table sugar, is particularly damaging due to its acidity, which exacerbates enamel erosion. Individuals who cut sugar often report their teeth feeling smoother and cleaner. They notice reduced sensitivity and fewer occurrences of gum inflammation. While regular brushing and flossing remain essential, removing sugar optimizes oral health, reducing the likelihood of costly dental treatments in the future. Number 2, less risk of gout. A 30-day sugar-free diet can significantly decrease your risk of gout, a form of arthritis characterized by sudden, severe joint pain caused by uric acid crystal buildup. Fructose, commonly found in added sugars and high fructose corn syrup, is particularly problematic. Unlike other carbohydrates, fructose is metabolized primarily in the liver, where it triggers uric acid production as a byproduct. When uric acid levels exceed the body's excretion capacity, sharp crystals form in the joints, leading to inflammation, redness, and intense pain, especially in the big toe. Excess sugar intake also contributes to insulin resistance and fatty liver disease, both of which further elevate uric acid levels. Individuals with high sugar consumption often experience recurring gout attacks. Removing sugar reduces this metabolic stress on the liver and decreases uric acid production. Studies have shown that individuals who reduce their intake of fructose-sweetened beverages experience lower uric acid levels and fewer gout episodes. Additionally, losing weight, often a result of cutting sugar, reduces joint stress and further aids in gout prevention. Those who adopt a low-sugar, nutrient-dense diet often report not only less joint pain, but also an overall improvement in their musculoskeletal health, allowing for better physical activity and quality of life. Number 3, hormone stabilization. Removing sugar from your diet for 30 days can lead to a remarkable improvement in hormonal balance, which is essential for overall metabolic health. 2 hormones, insulin and cortisol, are particularly influenced by sugar intake. Insulin regulates blood glucose levels, while cortisol is the body's primary stress hormone. Excess sugar consumption causes frequent blood sugar spikes, prompting the pancreas to release large amounts of insulin. Over time, this can lead to insulin resistance, where cells become less responsive to insulin, increasing the risk of type 2 diabetes. Additionally, these blood sugar fluctuations stimulate cortisol release, as the body perceives low glucose levels as a stressor. Elevated cortisol levels disrupt other hormones, affecting thyroid function, sex hormones, and growth hormones. Individuals who reduce sugar intake often experience more stable energy levels, improved metabolism, and fewer mood swings. Scientific research suggests that reducing sugar lowers insulin resistance markers within weeks. Furthermore, women with polycystic ovary syndrome, PCOS, a condition linked to insulin resistance, often see improvements in menstrual regularity and reduced symptoms when they cut sugar. By supporting hormonal equilibrium, a sugar-free diet enhances not only metabolic processes, but also reproductive health, stress resilience, and long-term disease prevention. Number 4, better sleep. A 30-day sugar detox can lead to notably better sleep quality, as sugar consumption directly affects sleep-wake cycles. Sugar causes rapid spikes and crashes in blood sugar levels, which trigger the release of cortisol, a stress hormone. Elevated cortisol interferes with melatonin production, the hormone responsible for regulating sleep. Individuals consuming high amounts of sugar often struggle with falling asleep or staying asleep due to cortisol-induced disruptions. Additionally, sugar-related blood sugar fluctuations can lead to nighttime awakenings as the body attempts to stabilize glucose levels. By cutting sugar, blood glucose levels stabilize, allowing cortisol levels to decrease and melatonin secretion to normalize. This results in more restful and uninterrupted sleep. A study published in the American Journal of Clinical Nutrition found that diets high in sugar were associated with increased nighttime restlessness, while reduced sugar intake led to deeper sleep. Patients often report falling asleep faster and waking up feeling more refreshed after eliminating sugar. Improved sleep enhances cognitive function, emotional stability, and immune response. By adopting a low-sugar diet, individuals can address underlying sleep disturbances naturally without relying on medications, while simultaneously supporting other aspects of physical and mental health. Number 5, fewer nighttime bathroom trips. Reducing sugar intake for 30 days can significantly decrease the frequency of nighttime bathroom trips, improving both urinary and sleep health. Excess sugar leads to elevated blood glucose levels, which when consistently high, overwhelm the kidney's ability to reabsorb glucose. This results in excess glucose being excreted in the urine, drawing water along with it, a condition known as osmotic diuresis. Individuals with prediabetes or diabetes often experience frequent urination, particularly at night, disrupting their sleep. Cutting sugar reduces blood glucose levels and lightens the load on the kidneys, leading to better fluid balance. Additionally, low sugar intake minimizes inflammation in the bladder and urinary tract, reducing the risk of overactive bladder symptoms. Medical observations indicate that individuals who eliminate sugar often notice a rapid reduction in nighttime urination within the first week. This improvement allows for longer, uninterrupted sleep cycles, enhancing overall rest quality. Furthermore, stabilizing blood sugar also reduces thirst, another common symptom driving nighttime fluid intake. Therefore, eliminating sugar not only benefits kidney health, but also significantly improves nighttime comfort, promoting better sleep hygiene and reducing fatigue-related issues during the day. Number 6, improve brain function and stable mood. Eliminating sugar from your diet for 30 days can significantly enhance brain function and emotional stability. The brain relies on a steady supply of glucose for energy, but excess sugar leads to rapid fluctuations in blood sugar levels, resulting in periods of hyperactivity followed by crashes. These fluctuations impair cognitive function, reducing focus, memory, and overall mental clarity. Additionally, high sugar consumption contributes to insulin resistance, which interferes with glucose delivery to the brain. Studies have found that individuals with insulin resistance often experience cognitive decline and are at greater risk of developing Alzheimer's disease, sometimes referred to as type 3 diabetes. Excess sugar also affects neurotransmitter balance, increasing the likelihood of anxiety and depression. Cutting sugar stabilizes blood glucose, ensuring a consistent energy supply to the brain. Patients frequently report improved concentration, reduced brain fog, and more stable moods. Research published in Neuroscience and Biobehavioral Reviews highlights the connection between low-sugar diets and lower incidences of depression and anxiety. By improving insulin sensitivity and supporting neurotransmitter health, reducing sugar intake enhances cognitive performance and emotional well-being, allowing individuals to better manage stress and achieve mental clarity. Number 7, improved eye health. A 30-day sugar-free diet can protect and improve eye health by reducing the risk of diabetic retinopathy and other vision-related complications. Elevated blood glucose damages the delicate capillaries supplying the retina, leading to microvascular complications. This condition, known as retinopathy, is a leading cause of blindness worldwide. Excess sugar promotes the formation of advanced glycation end products, AGEs, which cause oxidative stress and inflammation, further accelerating eye damage. Swelling within the retina, known as macular edema, often results from prolonged high blood sugar levels, causing blurred vision and, in severe cases, vision loss. Cutting sugar stabilizes blood glucose, reducing inflammation and slowing the development of AGEs. Research indicates that individuals with better glucose control experience slower progression of retinopathy. Patients often notice improvements in eye comfort, reduced dryness, and better visual acuity after reducing sugar. Ophthalmologists frequently recommend a low-sugar diet alongside routine eye examinations as a preventive measure. Therefore, eliminating sugar is a proactive step toward preserving vision, particularly for individuals with diabetes or those at risk of developing metabolic disorders, ensuring long-term ocular health and preventing vision loss. Number 8. Lower risk of kidney failure and nerve damage. Reducing sugar intake significantly lowers the risk of kidney failure and peripheral nerve damage, two complications frequently seen in individuals with long-term elevated blood glucose levels. Excess sugar in the bloodstream forces the kidneys to work harder, filtering out the glucose, which over time strains and damages the small blood vessels within the kidney's filtration units, known as glomeruli. This progressive damage can lead to impaired kidney function and, in severe cases, kidney failure requiring dialysis or transplantation. Additionally, persistently high blood sugar contributes to diabetic neuropathy, a condition where nerves, particularly in the extremities, are damaged due to poor circulation and oxygen deprivation. Individuals with this condition often experience tingling, numbness, or sharp pain in their hands and feet. Eliminating added sugars helps stabilize blood glucose levels, reducing the strain on the kidneys and improving blood circulation to the nerves. Clinical observations have shown that patients who control their sugar intake experience slower progression or even improvement in early-stage neuropathy symptoms. This dietary change is particularly crucial for those at risk of developing type 2 diabetes or already diagnosed, as it can prevent these severe complications and significantly enhance quality of life. Number 9. Stronger immune system and reduced inflammation. Cutting added sugar from your diet bolsters immune function and reduces systemic inflammation, both of which are essential for long-term health. Excess sugar suppresses the activity of white blood cells, particularly neutrophils, which play a critical role in combating infections. Research suggests that consuming large amounts of sugar weakens the immune response for several hours by interfering with phagocytosis, the process by which immune cells engulf and destroy harmful pathogens. This effect leaves the body vulnerable to infections, particularly during cold and flu seasons. Moreover, high sugar intake triggers chronic inflammation by increasing oxidative stress and promoting the release of pro-inflammatory cytokines. Chronic inflammation is now recognized as a driving force behind many diseases, including cardiovascular conditions, autoimmune disorders, and even certain cancers. By eliminating sugar, individuals often experience a reduction in inflammation markers, improved immune defense, and faster recovery from illnesses. Many patients have reported fewer colds, reduced allergy symptoms, and overall better health after adopting a low-sugar lifestyle. Maintaining a nutrient-rich diet, emphasizing whole foods while avoiding added sugars, creates an optimal environment for immune cells to function effectively, safeguarding the body from both acute infections and long-term disease development. For years, sugar has silently fueled your struggles, persistent weight gain, fatigue, aching joints, and the looming threat of diabetes, heart disease, or worse. You felt trapped, fighting cravings that always win, watching your health slip further from your control. But now you know the truth. Sugar is not just an indulgence, it's a toxin eroding your body from within. The good news? You hold the power to break free. Just 30 days without sugar can reset your health, reignite your energy, and strip away the weight that burdens you. physically and emotionally. Your transformation starts today. Will you take back your life? Go ahead. Trust yourself. I believe you can do it.